My name is Diana Almanzar, and I'm going to be reciting K-Wipe, check physician's orders, check for allergies, assemble my tools, assess the patient, wash my hands, um, introduce myself, identify the patient, provide for privacy, educate, evaluate, explain. All right, I'll walk in the room. Hello, my name is Diana. I'm going to be here to do an assessment on your newborn baby. I'm going to be checking the mom's wristband, and then I'm going to be checking dad if he's in the room, and then I'm going to match all those wristbands to the baby, make sure I'm assessing the right baby. And once that's done, I'm going to wash my hands, provide for privacy, put some gloves on, and I'm going to start with vital signs. So I'm going to be checking temperature. So we're going to be doing rectal temperature on the baby. Then I'm going to be hearing heart sounds. I'm going to be using the opposite side, the smaller side of my stethoscope to hear the heart sounds better. Okay, so I'll be hearing the aortic, pulmonic, tricuspid, mitral heart sounds. And then I'm also going to be listening for the apical pulse for a full minute. I'm also going to be assessing for respirations, and I'm going to listen to them for a whole minute. I'm going to be watching for them for a whole minute as well. After I'm done with vital signs, I'm going to also be hearing for bowel sounds. So start at the right lower quadrant, upper, okay. Once I'm done listening to the bowel sounds, then I'm gonna go ahead and measure. So I'm gonna start by measuring the head, the circumference of the head. Okay, 28 centimeters. And then I'm also going to be checking the circumference of the chest and the abdomen, guiding myself by the belly button. Once I'm done measuring, I'm going to go ahead and assess the skin of the baby. So I'm just going to be checking for any abnormalities or anything like that. I'm going to be checking the anterior fontanelle, the posterior fontanelle. I'm going to be checking the sutures. I'm going to be checking for any edema or cephal hematoma. I'm also going to be checking for molding. And then I'm going to be checking the reflexes. So I'm going to be checking the startle reflex on the baby. I'm going to be checking the rooting reflex on the baby. And I'm going to be checking the grasping reflex on the baby. Once that's done, I'm going to go ahead and check for PERLA. I'm going to be looking at the eyes, and I'm going to check the eyelids for any edema. I'm going to check the conjunctiva of the eyes. I'm going to check for any drainage on the eyes. I'm also going to be checking, make sure that there's no, the baby's not cross-eyed or anything like that. I'm also going to be checking the ears, making sure that they're symmetric to each other. I'm also going to be checking for any drainage or anything like that coming out of the ears. Once I'm done with that, I'm going to be checking the diaper. So if this one would be a female, so I would be checking the genitalia, and it's probably going to be swollen due to hormones and blood. If it's a male baby, I'm going to go ahead and check for circumcision site to make sure there's no infection or any blood going on the site. I'm gonna be cleaning baby. If the diaper has urine in it, I'm gonna be checking the urine for color and odor. If it has stool, I'm gonna be assessing the same thing, color and odor. I'm gonna clean the baby up, change the diaper, and once that's done, I'm gonna check the spinal cord of the baby. So the spinal cord of the baby is supposed to be straight. I'm gonna check for any bumps or masses that may be abnormal on the spinal cord. I'm gonna check for extremities. So the arms, I'm gonna make sure that they're the same length and that they're moving accordingly. I'm gonna check for the legs, make sure they're both the same length as well and that they're both moving well. And I'm gonna check for the hands and feet, make sure they have the right amount of digits and there's no, they're not sticking together or any fanning going on. And I'm also gonna be checking for the hips, making sure that they have good movement on the hips. And then I'm gonna go ahead and that's it. All right, so that's it with my assessment, and then I'm just gonna get the baby ready and comfortable and give it to the mom if she wants to hold it, and then I'll be all done.